Bismillahir Rahmanir Rahim. Wassalatu wassalamu ala Rasulillah. Sisters and brothers, it's a pleasure to communicate with you in this very important Symposium Ilmiah Masjid, the 6th International Islamic Conference held in the historical city of Bandung, Indonesia. It's a great achievement that you are holding this conference and you are discussing many important things for the future of our Ummah. I will be sharing with you some ideas and perspectives and hopes and aspirations about Islamic medicine. Now, the motivation of talking about Islamic medicine is the motivation of integration. How do we integrate Islamic values into medicine as a discipline of knowledge and as practice? Now, Islam, as you know, is not a set of being. You don't say, I'm a Muslim, I'm not a Muslim. When you say I'm a Muslim, it means you are taking actions to be a Muslim. Islam is action. It is a verb. It is not an adjective. It's not a noun. And so what we have to do are endeavors that require integrating Islamic values in medicine to make it better. Now, integration is infusing or putting the moral teachings of Islam that we get from our Aqidah and from our Sharia into medicine. That's integration. But when we talk about integration, we are not talking about parochializing medicine. Parochializing medicine means creating medicine for Muslims only. We are not talking about medicine for Muslims only. We are talking about international medicine for everybody. Why? Because the Islamic values that we want to put in medicine are universal. They apply to all humans, and all humans can understand them. So when we talk about Islamization of medicine, we're actually talking about universalization of medicine. So many times when we talk about integration and universalization and universality, many people misunderstand this or they distort it. Unfortunately, this happens from Muslims and also non-Muslims. So I'm going to clarify this issue, inshallah, in the remaining time that I have. I want to say that I'm not talking about theory because we have achieved a lot in the past 2 or 3 decades in the endeavor of integrating medicine. And over the past half century, many things have happened to achieve Islamic medicine, to achieve integrated medicine, but we still have a lot to do. So we shouldn't just feel that we have arrived. Now, let's look at the historical background. Before 1980, the concept of Islam in medicine was not very clear. But there was a general interest of relating Islam to medicine. This was part of the general Islamic awakening that was taking place when people were looking for the Islamic dimension in the economy, in politics, in industry, and agriculture. So naturally, they also looked for the Islamic perspective in medicine. Before 1980, Islamic medical associations were formed to bring together Muslims to talk about Islam and medicine. The first one was in 1967 in the US and Canada, but this was soon followed by other countries. Islamic medical associations, or also called IMAs, were formed in South Africa, in Pakistan, in Nigeria, and many other countries. These associations brought together these Muslim physicians. But once they got together, they started asking themselves the ultimate questions. Who are we? What is our mission? What is our origin? What's the future? So in order to answer these questions, they were forced to come closer and closer to the concept of integration of Islam in their profession. It became clear to them that answering these questions requires that they bring Islamic values in their profession. But the integration was not yet clear. This became clear much later on. Some of them looked at the Islamic Medical Association as just a normal association of Muslim members, Muslim doctors and Muslim nurses. This view drew criticism from the general medical associations because they were saying, okay, why do you set up an Islamic medical association separate from the main medical association? What's special with you? So this view was not very successful. Some others looked at the Islamic Medical Association from the service point of view, providing help and support to students and young physicians. But again, this was not enough. Some looked at the Islamic Medical Association as a forum for medical and relief programs for Muslim communities. So some Muslim communities, because of war and poverty, had medical needs. So the IMA, the Islamic Medical Association, was trying to solve those problems. So these were various views of what an Islamic Medical Association shall be. But as we shall see, they were not satisfied. We needed to go deeper. So between 1980 and 1995, we went deeper into understanding the role of medicine, of Islam in medicine, because there were more Islamic medical associations. They were very busy in relief and refugee assistance in many places. They got bigger budgets and they went to more parts in the world. And then slowly, the Islamic medical associations in different countries started working together to form networks. That's why they formed the Federation of Islamic Medical Associations, FIMA. They were becoming international, getting together and communicating. It was again at that time that interest in the religious education of the future physicians picked up. Especially, I would like to mention that YERS in Jakarta and Azhar in Cairo were universities that took this very seriously, and they introduced Islamic religious education curricula in the medical schools. They say, let us start off the physician during training understanding Islam and the message of Islam. At the same time, there was a return to da'wah, religious practice, religious propagation in universities and hospitals. There were also international conferences about Islamic medicine. In Kuwait, 1981 and 1982, I attended both of these. At these conferences, we started asking the question, what is Islamic medicine? Generally, at the beginning, the concept of Islamic medicine was that of the traditional Muslim medicine, because Muslims, as you know, from the 3rd century of Hijrah, had great doctors like Ibn Sina and others. So they looked at the medicine practiced by those as Islamic medicine. So those traditional Muslim medical practices that are still done today, they still exist today, like Tib Yunani in India and Pakistan, also called sometimes Tib Nabawi, and some herbal medicine. So some of these types of medical approaches and modalities are survivors of this earlier traditional Muslim medical practice. But this was also not enough. People were intellectually frustrated because the paradigm of traditional medicine, being the representative of Islamic medicine, was not understandable, because they could not relate the traditional medical practices with the scientific medicine that they were studying and practicing in modern hospitals. So the questioning continued until 1995, when we came to a definition of what is Islamic medicine. A seminar was organized by the Islamic Medical Association of Malaysia in July 1995. And I attended that seminar, and many other doctors attended. And we had a serious discussion, because at that time, Muslim physicians in Malaysia were going through a lot of arguments with practitioners of traditional medicine. Those who were practicing traditional medicine were convincing hospitals, patients not to go to hospitals. Don't go to hospitals. Those are non-Islamic medicine hospitals. Come and get care from us, the traditional doctors. Of course, there were many problems, because diagnosis sometimes was delayed, and patients, by the time they came to the hospital, their infection and their cancer were already very advanced. So a paper presented at that conference offered a definition of Islamic medicine, and I'm going to show you the part of the abstract of that paper. So that paper changed the whole paradigm. Now the concept of Islamic medicine carried a new meaning, and it's the new meaning that we are still using until today. So Islamic medicine, therefore, according to this paper, is defined as medicine whose basic paradigms, concepts, values, and procedures conform or do not contradict the Quran and Sunnah. So that's the basic definition. Islamic medicine does not refer to specific medical procedures or agents used at a particular place or a particular time. So this idea of Islamic medicine is that of medicine that's universal, all-embracing, flexible, and allows for the development of new methods of treating diseases, because the framework is now known. It does not contradict Quran and Sunnah. Once we took up this definition, then we started thinking about transforming medical systems. So Islamic medicine becomes the result of an Islamic critique and reformulation of the basic paradigms, research methodology, teaching and practice of medicine existing at that time. This process of conceptual transformation is also called the Islamization of medicine, and it was described in detail in the paper that is referred to at the bottom of this slide. With this definition, things started changing and moving very fast. So after we got the definition, many Islamic hospitals and polyclinics were formed in Muslim countries and Muslim majority countries. What was the motivation? The main motivation was to practice medicine from an Islamic perspective. But the problem was that the Islamization paradigm was still in its infancy. It needed to be developed more, to be explained more. But people were in a hurry. So they said, okay, we shall go ahead and set up hospitals and clinics and try to practice as much Islamic medicine as we can. We'll solve problems as they appear. So the first step that they did in these Islamic hospitals was to make the hospitals ibadah friendly, because that's the beginning, that the patient and the doctors treating him must undertake acts of ibadah. Then after that, they developed standard operating procedures and criteria based on the Sharia. And they developed many systems and many guidelines until some hospitals were designated as Sharia compliant hospitals. All their procedures, their environment was to be according to the Sharia. At the beginning, these Islamic hospitals experienced severe financial problems because they were small. But as they became popular and attracted more clients, they improved their financial situation, and many of them today are doing very well. They did not stop at hospitals. They also thought about education. So in this period, medical education from an Islamic perspective became a reality because faculties of medicine changed their curricula to reflect Islamic values. The faculties of medicine focused on two main areas: medical fiqh, al-fiqh al-tibbi, and medical ethics. So medical fiqh dealt with the impact of disease on the regulations of tahara and ibadah for the patient. The patient needed guidelines on what to do. The physician needed guidelines on what to do. At a later stage, this movement covered issues of marriage, munakahat, and business, al-mu'amalat. Now, many fiqh rulings were brought up by jurists and were solved because at the time, qiyas and ijma' were being used to solve practical fiqh problems that were experienced in the hospitals. The second part of it was to develop medical ethics from the Islamic perspective. So medical ethics was used to teach and practice. This required a lot of energy because medical technology was creating new dilemmas that we couldn't solve using the traditional books of fiqh. We had artificial insemination, IVF, organ transplantation. People were playing with chromosomes and genes. So these are issues that you could not just look up in a book of fiqh. So we had to do a lot of ijtihad to try to solve problems of ovum donation, sperm donation, surrogate motherhood, and disposal of excess fertilized embryos. So many fatwas in this time were being made to come up with the solutions to these problems. Advanced life support technology also created problems. When do you decide to withdraw life support? Can you use brain death as a criterion of death? In the genetic area, ethical issues arose about gene therapy, genetic engineering. So all of these could not be resolved using the traditional fiqh, and we had to go on to use new tools. Starting the year 2004, the theory of Maqasid al-Sharia emerged as the main guide in this area of medical ethics. Maqasid al-Sharia means the greater purposes of the law. When you look at these problems from a higher perspective of the big purposes of the law, then you can undertake ijtihad maqasidi and you can start solving them, inshallah. Now, we have come a long way, and I want to show you some of the Islamic hospitals that were formed during this time, and many of them, alhamdulillah, are continuing to work, propagating the concept of medicine as medical fiqh, al-fiqh al-tibbi, and also propagating the concept of ethics from the Islamic point of view. This is the Islamic hospital in Amman, Jordan. Was among the earliest. He became very famous. This is the Islamic Specialist Hospital in Kuala Lumpur. It is still going on, propagating and expanding. This is the Islamic Hospital in Bandung. I've visited it several times. This is Sayyidina Bakar Islamic Hospital in Uganda. This is the International Islamic Hospital in Yogyakarta. So, besides forming Islamic hospitals, also several organizations were formed to propagate the idea of Islamic medicine. I have already talked about Islamic medical associations that were local, but also these ones coalesced, they united into the Federation of Islamic Medical Associations, FIMA. The Islamic hospitals also formed an international organization called Islamic Hospitals Consortium, IHC, so that they could coordinate. And then medical colleges, Islamic medical colleges also formed a consortium of Islamic medical colleges called SIMCO. So the concept of Islamic medicine was now becoming something organized, formal, with both local and international organizations. Then we had to teach this Islamic medicine because you cannot practice it when you do not train the doctors who will practice it. This is the Kuliah of Medicine in Kuantan, Malaysia. It was the first faculty that taught Islamic medicine as part of its curriculum, and many others did follow. Now, that faculty has set up an Islamic hospital. It's called the IIUM Medical Center in Kuantan, a very big hospital where doctors can be trained to take care of patients according to the Sharia. So this hospital is Sharia compliant. Now, what's the future? As I have gone through, you have seen that we have achieved several things. So where are we going for the future? I think there are many challenges in the future, but inshallah, we shall be able to deal with them. Genetic engineering, new reproductive technologies, and gene therapy are producing new ethical dilemmas that will require solutions. As I said, we cannot use the traditional fiqh books. We have to use a new type of ijtihad called al-ijtihad al-maqasidi, and it is being used extensively to solve these problems. Now, on the business side, medical care is a big business. So Islamic hospitals must learn about Islamizing their business models, following fiqh al-mu'amalat, because they must have new methods of healthcare financing so that they can survive and compete with the other hospitals. And I think most likely they will develop a form of takaful insurance. The area of pharmaceutical research also needs to be taken care of because pharmaceuticals have got many ethical challenges. Some of them may contain haram components. Some of them may be used in improper ways that are not according to the Sharia. So pharmaceutical industries are another area of Islamization that we'll need to look at. Now, let me now move to the bigger view of what is integration. So we need to integrate Islamic values into medical education, training, and practice in order to get quality healthcare for Muslims. Now, we cannot succeed in medicine as a community or as a civilization if our development is not based on our Islamic values. Now, since we started in Malaysia, the movement of Islamic medicine, we are beginning to see the fruits of integration. So integrated medicine is being taught to doctors and nurses, and there are several Islamic or Sharia compliant hospitals. And I think in the next 20 years, we shall have more such hospitals. And I think maybe inshallah, wa ma dhalika Allah bi aziz, we are looking forward to an integrated healthcare system that will have health insurance, integrated research, and integrated pharmaceutical industry contributing to the health, not only of Muslims, but for the whole humanity. Now, there are 5 components of integration. Conceptually, we need to teach the Islamic concepts of life, death, disease, and treatment, because Islam has got its own meaning for these. We need to teach basic medical sciences as evidence of Allah's creation, Sunanullah fil Kawn. We need to teach Islamic ethical and fiqh aspects of diagnosing and treating disease. And then we need to talk about the family and the community, because medicine doesn't stop inside the 4 walls of the hospital. The problems that bring people to the hospital start in the community. If you don't go into the community to solve the problems, you will continue dealing with problems coming in the hospital without any end. I think the future of integrated medicine is very bright. This not only for Muslims, but for the whole humanity. Because as I said, Islamic values are universal. They are not parochial. They are not only for Muslims. They are useful for everybody else, and they can be understood and practiced by all. Tawheed, which is our basic aqidah, is the basis for integration. If there is one creator for the whole universe, Tawheed al-Rububiyyah, therefore everything in the cosmos must fit together. And that is why we say that Islamic values, al-Qiyam al-Islamiyya, must also fit into medicine. We cannot separate things. Now, let me talk, as I come to the end, about one discipline in medical education to show you how we can integrate or Islamize it. Let us talk about the community health curriculum that is taught in many medical schools, most of them starting in the 4th or 5th year. So community health starts with community diagnosis, then programs are made to deal with obvious and external manifestations of the community problems. But I think from the Islamic perspective, community health should be more about establishing the normal and not diagnosing and dealing with the abnormal. If you have not done something about establishing healthy communities, balanced communities, well-organized communities, there is no point to try to deal with the addiction, family breakdown, and violence. You should start by building the normal, by strengthening the community institutions before trying to deal with the outcomes of those. But the current community health curriculum apparently starts with community diagnosis of problems. I would like to change this curriculum to go deeper and deal with the society, with the community, to make it a normal, healthy community before problems appear. Now, the community has got several institutions, and this is what we need to teach. Gender. How can the two genders work together? The family as a natural social unit. How can we preserve it? Marriage as the start of family formation. Parents and relatives, children, who are the next generation. Islam has got teachings about all of these aspects of the community. We need to start teaching medical students about these components of a society. And then we need to teach them about community institutions. The community must have institutions. What's the role of the Masjid? What's the role of ukhuwa, brotherhood? What's the role of takaful, people helping one another? What's the role of shura? What's the economic system, al-mal? So I think if we're going to talk about community health, we need to start with these components and make sure that they are understood, they are well organized, they are harmonious, they are well balanced before we talk about the problems. We need to talk about lifestyle, community problems, sexual perversions, then addictions poverty, and violence, which are the results of the breakdown of the community, of the society, we start dealing with them. The present community health curriculum, unfortunately, starts with the community diagnosis of problems that occur when community institutions are not working very well. So we want to change this curriculum so that we start with the beginning. And there are other community actions that we need to teach our medical students in order to make them successful doctors. They need to know about da'wah. Da'wah is a way of changing people, their behavior, their thinking to avoid problems. We need to teach them about al-amru bil-ma'ruf wal-nahyu anil munkar, enjoining the good and forbidding the bad. We need to teach them about social change. How can we bring about a social change in a positive way? So this is just a short expose of what Islamic medicine is. I have talked about the developments from when we thought of it as traditional Muslim medicine until we got a definition of what's Islamic medicine. And this definition gave rise to a lot of good things. Many Islamic hospitals, many Islamic colleges, and then developments in medical fiqh, developments in medical ethics from the Islamic point of view. And towards the end, I talked about the community health curriculum, which I'd criticized because I think many of these curricula start with diagnosing problems in the society. I think it's more important that we teach about how to create a normal, harmonized, balanced society, and the Quran and Sunnah are full of these teachings. I think we should start there before we go on to resolve problems. And I think if we can make our communities qariyatan tayyiba, if we can make our communities and good, many of the community problems that we are facing now will disappear on their own. Thank you very much for listening to me. Wassalamu alaikum wa rahmatullahi wa barakatuh.